With the increased number of cases of swine flu being reported across the country, more and more people are curious about the virus itself and what they can do to keep from getting it. Jackie McReynolds with the Springfield-Greene County Health Department says they have been working with local schools, healthcare providers, and other organizations to make sure we are prepared here in Greene County.
At this time, the Missouri State Health Department has reported that they have one probable case of swine flu north of the Kansas City area. That means that the person meets a definition, has the symptoms that could be swine flu, maybe has had a travel history or close contact with a case, but has not yet been laboratory confirmed.
Lynn Morris, owner of Family Pharmacy, says that some, more than others, could be susceptible to catching the strain.
Older people are very susceptible to any type of influenza, as well as very young people. Those are the two age groups that could hit the most.
While no cases have been reported here in southwest Missouri, there are definite symptoms to be on the lookout for.
Runny nose, stuffy nose, a fever of 100 degrees or more, a cough, body aches, tiredness, chills, and some people have been reporting nausea, vomiting, and diarrhea. If you have those symptoms and you've recently traveled to an area that has confirmed cases, or you've recently had contact with someone who has a confirmed case, then we encourage you to contact your healthcare provider for advice.
McReynolds says that even though the current strain of swine flu is new, it is treatable.
This particular strain of swine flu is responding very well to the Tamiflu and the Relenza, the antiviral medications. At this point, the antiviral medication is only to be used for treatment.
But Morris says if people misuse the drug, it could cause problems if cases started showing up in Greene County.
What we're concerned about, all of a sudden today, we started getting numerous calls to our pharmacies wanting to know if we would fill a Tamiflu prescription. Well, we know that all those people don't have the flu. My point was that I want the physician to write on the prescription or to tell us over the phone that that patient truly has exhibiting flu-like symptoms. This is not a drug that you take to keep from getting it. This is a drug you take when you do get it. And the problem is if everybody buys it right now and just puts it in their first aid kit at home, unfortunately, we won't have enough supply to take care of the sick people if we do get sick people.
So what can you do to reduce your chances of catching swine flu or another virus? McReynolds adds that the answer is just as simple as following the advice your mother gave you as a kid.
Good hand washing, at least 20 seconds with soap and water and rub vigorously. That's a proven disease prevention method that can be used against any illness. Another thing to think about is if you see someone coughing or sneezing, just keep a distance from them, about 6 feet away, so that those airborne droplets don't get into your mouth, nose, or eyes. And then if your hands are not clean, just avoid touching your face.
I'm Charlie Mason with Midwest Family Radio.